This is Today in Amarillo.
Welcome back to Today in Amarillo. This morning we're out here on Sky Studio talking about hair loss. And appropriately, the wind is kind of blowing our hair in our faces. But Dr. DJ Verret is here this morning. And, you know, we've kind of been hitting the basics this morning, some of the myths and some of the good, bad, and the ugly about hair loss. And one of the first things that you probably think about is that hair loss can only happen in men. Not true, right?
Absolutely not true. Hair loss can affect women. It's not as patterned as it is in men. And more often than in men, it's due to an underlying medical condition. So women in particular, it's very important to determine the cause of the hair loss, as if it is due to an underlying medical condition, correcting that condition can actually correct the hair loss. The other thing that women, we talked about this actually after the last segment, the other thing that affects women more often than men, or at least they're bothered by more, eyebrow loss and eyelash loss. Right. And fortunately, there are a couple of treatments out recently for women for eyelashes. There's a lot of advertising going on for a product called Latisse. Latisse, the medication is called Bimatoprost. It's actually used to treat glaucoma as well. It works very well, but you have to use it for at least a month or two before you see any results. And if you stop using it, the results will go away. The other thing for women with eyebrow loss, most of the time it's due to overplucking actually. You can actually damage the eyebrows so that they don't grow back. You can actually do a hair transplant for them, similar to what you do in men, and actually create permanent eyebrows.
Lots of options for you if you are experiencing hair loss. But what's like a normal hair loss? Because every day you lose a few hairs, but when should you start to be concerned? Right,
and that's a very good question. You will normally lose about 100 hairs per day. So if you see hairs in the drain or on your pillow, that's not a problem. When you should start becoming concerned is when you start to see thinning in the hair. That means you've lost about half of the follicles, the part that actually grows the hair on your scalp. And at that point, you really should talk to someone, because the key to any treatment is actually preserving what you have and slowing or stopping the hair loss.
Very good. All right, we'll have more in just a few minutes with Dr. Verret. We're talking about hair loss. This is Dr. DJ Verret, and he's been here all morning and kind of clearing up some of those myths that you might have. And what are some of the big ones that we've hit on?
Some of the big ones we've hit on: wearing a hat doesn't matter in hair loss. Genetics does play a factor, but it's not just looking at your mom's side, it's actually looking at both sides. Talk to your doctor early about the reason for your hair loss. Treatment is the key. There are a lot of surgical and non-surgical treatments. And for folks who've lost their hair, consider hair transplants. They aren't what you thought of in the past. They're actually very natural and very long-lasting.
And it can be male or female, men and women.
And
both,
male
right?
or female, absolutely. And also in women, particularly eyebrows and eyelashes, hair transplants, Latisse, several different options for treating those as well.
And you don't really think about that when you think about hair loss. It's not my immediate thought is eyebrows and eyelashes, but yeah, lots of options.
I know a lot of women that kind of freak out because you put on mascara, your eyelashes are falling out, you're afraid that they're not going to grow back, but they do grow back, right?
Eyelashes do grow back, absolutely. The hair anywhere on your body goes through a natural cycle of growing, falling out, resting, and then starting to grow again.
Okay.
What you have to worry about, though, is plucking your eyebrows and plucking your eyelashes. Those can damage the follicles. The same thing with plucking your hair, and actually cause hair loss. So you got to be careful of that.
Okay. Well, we will have all of these tips that we've talked about this morning over on our website, myhighplains.com. Thanks for coming in this morning.
Well, thanks for having me. I appreciate it.